Are you ready to learn 3 actionable steps as a labor and delivery nurse you can do today to provide respectful maternity care and prevent birth trauma? I'm so excited. We are bringing this article to you. It's Birth Trauma Awareness Week, and one of the more advanced forms of birth trauma can lead to PTSD, post-traumatic stress resulting from disrespectful care and maternity. Hey, Hannah.
Hi, Mandy.
Hey,
I'm Hannah. I can introduce myself, actually.
Sure.
I'm Hannah. I'm a labor and delivery nurse. I am located in Ontario in Canada. I also have a blog. Babytalk.life is the URL for that blog. And I also am pretty active on Instagram at babytalk.life. Yeah, and I'm very happy to be here. I love talking with you, Mandy.
Oh, great. Well, what Hannah didn't say is that she's also a really amazing labor and delivery nurse and mom of 2.
That's true. That's
true.
So you might actually hear one of them wake up while we're doing this. So.
Oh, yeah. So she's like listening in one ear for her baby, and I'm blocking my kids out in my other ear. So, hey guys, welcome back to my channel. My name is Mandy. I am the birth nurse, and I have helped thousands of people give birth as a labor and delivery nurse, and hundreds of people prepare to birth boldly through online courses and childbirth classes. And I have invited back Hannah. We've actually never met in person.
I can't wait until we do.
I know. I don't know when that's going to be, but we just love talking birth. And especially this week, we love talking birth trauma. And that sounds morbid. It does, but we're super passionate about improving birth culture around the world. So if you are a fellow labor and delivery nurse, drop nurse in the comments right now. If you're a student nurse or wannabe labor and delivery nurse, drop nurse in the comments right now. We want to know where you are and who we're talking to. And question for the night, what are the respectful and compassionate words or actions that either you remember from your birth experience or you remember being taught that really, really work during labor, during birth for people? Things that you do or say, things that you've seen, done, or said. Drop those in the comments so we can all learn from them. So tonight, Hannah had this idea. She so graciously said, let's jump on a video and talk about this amazing, what's this called? Article?
Yeah.
This amazing article. It's only 8 o'clock our time and I already don't have words. It is called Can Respectful Maternity Care Save and Improve Lives? And it's written by Christine Morton, Dr. Christine Morton, and our beloved Penny Simkin, who, if you are not new to my channel, you have heard her name before. If you are new, don't forget to subscribe because I don't want you to miss anything. We do this very frequently. I post videos every week. So this article, I will post it down in the show notes, was published this year. So Hannah, you sent me this article. What'd you think?
I think the first thing that kind of caught my eye was the term respectful maternity care. I hadn't really thought about it in that way before. Like you're saying, we're talking about birth trauma and how we love birth trauma and how morbid that is and whatever.
Right.
But it's kind of like, what is the antidote to birth trauma?
That's right.
Or what can we do to prevent birth trauma? So like that really stood out to me.
Respectful maternity care definition. Because because she said she liked the word and the definition respectful maternity care. The first word that is the article under introduction is respectful maternity care is, if you've never heard this, you don't have to write it down, but I printed it out. I don't print very many things out. This is a big deal. Organized for and provided to all women in a manner that maintains their dignity, privacy, and confidentiality, ensures freedom from harm and mistreatment, and enables informed choice and continuous support during labor and childbirth. And then respectful maternity care is not a luxury, but a human right. And it goes on to explain a little more. And then it explains disrespectful maternity care a few paragraphs later. And this is around the globe. This is not the US. This is not just Canada. This is around the globe. The meaning of disrespectful maternity care has evolved and today generally refers to maternity care that includes any of the following 7 physical abuse, sexual abuse, verbal abuse, stigma and discrimination, failure to meet professional standards of care, poor rapport between women and practitioners, and health system conditions and constraints. And for the ease of this video, we are going to use the pronoun women, referring to all birthing people. So disrespectful and respectful maternity care. Had you ever heard those definitions or?
Not really. It's obviously something that, I probably think about every day at, my job.
Right.
But I never actually kind of dissected it in that way. And it's interesting, like just when you're reading those 7, what do they call it? 7 things that are included. Number 6, the poor rapport between women and practitioners. That's probably one of the things that I see quite frequently. And not only that, that's one of the things that I try to, like that nurse-patient relationship is probably the one thing that's like super important to me. And I try to build that immediately if I can. And so like, even though I never heard it before, I feel like it's something that, is on my mind. I just hadn't been kind of diagnosed or, said in those terms before.
It is like I think it's one of the biggest things you can control as a labor nurse, and you have, the power over is that relationship, and like, doing like self-work on how do I come across when I'm listening? How do I come across when I'm talking?
Sure.
How is my body language? Really advanced ways of learning how to put your best foot forward, because we work with a lot of different types of people. So
Definitely.
yeah, we have to read them quickly, but they also read us very quickly. But it's number 6 on this list of disrespectful care.
Mm-hmm.
So if we don't do a good job, or if the system supporting us is part of our failure, because, nurse-patient ratios and breaks and, risk and reward
Burnout.
and having our back in really tough situations and tough discussions. And we see life and death. So we are super traumatized ourselves by our own, what we see and by events that we are part of. So,
and I don't think it's actually taught, really, if you think about it. It's
Yeah.
something that you figure out along the way. Like, I'm sure as a new novice nurse, that's not one of the first things on my mind. Like, you're just nervous about every little thing that can kind of go wrong, and you're not thinking, okay, I need to sit down with this patient and like form that patient relationship. It comes with time, right? Like, it kind of, as you get more comfortable with the task-oriented stuff that nursing is, then you have time to focus on, the relationship, and you realize how important it is.
Yeah, labor nursing is hella scary.
Yes.
Remember, like, being new, meeting a whole room of strangers was scary, let alone like, are you having a fluid embolus?
Yeah, exactly.
So this article talks about saving and improving lives, and it focuses on PTSD from childbirth. So that's why we are bringing, I should put this at the beginning, we are bringing this article to you for you to read and digest and learn from, because it's amazing, and 2, it's Birth Trauma Awareness Week, so you can learn about what birth trauma is. And one of the more advanced forms of birth trauma can lead to PTSD after childbirth. So that's what this article focuses on, is post-traumatic stress resulting from disrespectful care and maternity.
Yeah, wasn't it surprising that, like, what was it, up to 45% of women report that their births are traumatic? Isn't that just like a mind-blowingly high number for you? Like, to me, I was thinking, okay, I feel like a lot of women, after birth say it is. I was thinking maybe 20%. That was like the number in my mind, right? But they say 33 to 45%. It's crazy.
I think that a lot of cultures just say, at least you're alive, or at least you have a healthy baby. I don't know why you're upset about it. And so, people push back what happened and don't identify as trauma, because there are people who do die, or there are babies who do die. And so it's reserved for that, not for someone who had a healthy baby.
Yeah.
Is that your baby waking up?
No, that's my cat. One of my Instagram stories this week was that sentence, you come out of a traumatic experience, say you have like an emergency C-section where everything's kind of crazy and chaotic, and then afterwards, the nurse or the doctor, whoever comes talk to you, and like, are you okay after all that, and the patient might be like, oh, I'm pretty shook up. and then it'll be like, oh, at least you and your baby are healthy. Like, be thankful for that. And it's one of my biggest pet peeves, because that is kind of undermining that person's experience, right? So are they going to go home and trying to push that kind of under the rug and be like,
right,
I'm alive, my baby's alive, so I should be okay? And I don't think that's an okay thing to say to people at all, because then you're kind of just dismissing the whole mental health portion of that person's reality, and I don't like it.
Yeah. If you've heard that, put yes in the comments right now. If you've said that, put yes in the comments right now, because Hannah and I did not come out of nursing school understanding this, and we do not provide perfect nursing care.
Oh, no.
No. Oh, no. So we are here to be the first to say we have told people the wrong thing before.
Oh, for sure.
And that definitely contributes to some of my work that I have to do personally, is like looking back and thinking, what did I do? Like, what did I
And not only that, it's like when you hear someone say something you don't agree with, we're all a team in the hospital, right? It's like you can't kind of go to that patient or person and say, I don't agree with what that person says. So it's a really difficult spot to be in. But at the same time, you want that person going home with the right tools to kind of deal with what happened, and not say, you're fine, so just forget about the trauma. And the other thing is, in the moment, like, we see a lot of stuff, and I've probably seen a lot of births where I'm thinking the woman's going to go home and she probably has trauma, or the family is going home and they probably have trauma. But it's kind of like, what do they do from there? Like, what kind of support is there? I think that's part of the huge problem too, and why probably a lot of women go into PTSD, is because there's no support, right? There's nothing that says that's normal.
Right. And you don't see your provider for 6 weeks, and you don't bring it up because your provider possibly was part of it, and you would risk hearing like you're fine again, or you don't know what you're going to hear. I definitely can personally relate to just not knowing where to turn. Like, what do I do? Luckily, I think it's getting better with social media, and I never thought I would say that, but there are so many stories out there now. And while you don't want to flood yourself with birth trauma stories as a pregnant person, you decide if you were emotionally hurt by your own birth. And what I thought you were going to say was, as a nurse, we will assume that there's birth trauma, and we can't do that.
No.
So we can't put that on someone.
No.
So I'll tell you what I say after after a traumatic, potentially traumatic experience, because I don't know what's traumatic for everyone, but I do know some intense, like, near life or death things that happen. Like you said, like an emergency C-section falls into that category. And what I try to say to my patients to help them kind of start that path and not put trauma onto them, because I could be traumatized by something as secondary trauma, watching someone go through something, and they may never feel or identify with birth trauma. Maybe I know how life and death it was, and maybe she always felt supported and always felt taken care of and always felt someone was in control and things would be okay, and I didn't.
Yeah, it's true.
And so that's a different topic.
Yeah.
But similarly related, when we talk about labor and delivery nurses providing really great care, we have to deal with our own shit and own it and know that it's there and not put that on other people. I think Penny and her co-writer do a great job of identifying that it is their perception of the event. Yeah.
It's trauma is whatever you say is trauma. It doesn't have to be, so specific and obvious, like a postpartum hemorrhage or, something like that. It can be just, the attitudes, like the perception of the attitudes. And like, you can't really feel that or perceive that. Like, I've heard
absolutely not
crazy stories where the same thing, like, I thought everything was great.
Right.
Or at least as good as it gets.
Yeah.
And then that person turned around and said, it was actually like a horrific experience for me.
Yeah. So
hard to navigate that, because then how do you fix it if you think that things are great? It's like,
right. I think language, like you said, is a really good start. And if someone is going to leave this video and do one thing, if you're going to watch us rant for a few minutes and do one thing. It's listen to yourself when you talk.
Mm-hmm.
And really, truly, if you're talking to your sister and she's able to really talk back to you, say, no, Mandy, okay, maybe I wasn't going to die, but I truly felt like I was going to die.
Mm-hmm.
And hear that from someone that I truly, deeply love. Think, oh my God, what would it feel like to really, truly think, even for a split second, that you were about to die? And that doesn't even speak to like their partner who has their own set of things going on. I wouldn't say back to them and feel like I was doing a good job being like, yeah, but you didn't.
Yeah, exactly.
Like, okay, you felt like you were, but whew, like I do on roller coasters, but I didn't. And so I ride it again. Like that.
Yeah.
That's not helpful.
Not at all.
But if you've heard people say it, the people that trained you said it, the providers around you are saying it, like it's easy to get into that. You're not a bad nurse.
No, 100%.
It's how it's treated.
Yeah.
Sometimes after a big event, like you say, like a postpartum hemorrhage or the obvious ones like D cells and an emergency C-section, or a huge repair, a very long repair, or a very painful, surprisingly painful birth, an epidural that didn't work, or she perceived that it didn't work.
Yeah.
Right? Because if you start thinking, so I'm hoping that you're leaving this video, and if you're getting any aha moments, put them in the comments. It's going to help you remember them. If you type them out and say them and they become your new thing, own them, because we all had to do this. We all are doing this all at the same time with you. Every day I have a fly friend.
Yeah, you're never going to be perfect nurse. Like that's just, it's not going to happen. Just the sooner that you realize that, the better. It's like you can get better every day, but and we strive to get better, but it's kind of like, enjoy the journey.
Oh my
and
gosh.
Never stop learning and never stop, taking this in. I think that's key. Mm-hmm.
Yeah. So taking in, your language, you don't have to guess what they're thinking. You just have to listen. If they feel like their epidural is not working, imagine, being stuck, laying down, feeling like you were expecting this help and you're not getting it, or feeling like someone's out to get you, part of their birth team, like they have no control over that, even if it's not the case, like they feel like that is happening. If now some of those aren't as obvious, and I don't want to, and it's really hard to bring stuff like that up. Like you said, like I'm not going to bring up as part of a team, hey, I really think that doctor did you wrong. Like
you can't really do that.
Yeah, no, I mean,
it's hard to put it in the right, like use the right language with that.
Right. Right. Did you wrong, like maybe emotionally, or didn't introduce themselves.
Yeah, speaking of which, that reminds me, in 10 minutes, I have to go put the chickens in.
Oh, so no, I'm talking about things like I have said this, like a provider did an exam while talking on the phone. I talked about that.
Wow.
Okay, so I did. And I think that it didn't discredit that provider any more than she or he had already discredited themselves.
Yeah.
But it increased confidence in the team and the fact that it is a team. Like you're never alone.
No.
If you feel, worried about something, you can definitely tell me. I'm a human. I obviously know that was a mistake.
Mm-hmm. Yeah.
And that was obvious and very, very uncommon. I've never had that conversation any other time. But something like a sigh. And if I've seen the patient's eyes, like this is rare, this is uncommon also, but if I've seen like a look that she gave and I'm like, uh-oh, but I know that something's going on outside of the room, it can be like, okay, I can address, like, I saw that is not you. And I know what it is, and I can't talk about what it is, but it is not in this room. That is a human being, and that is what you heard from that human being.
Mm-hmm.
But it's totally okay. You're okay. It is not the relationship with you. And that's so uncommon, like that I would confront that. Because it's tough. It's
I know.
Like interpersonal almost, but
I know. And the thing is too, like, the best case scenario would be you could bring that other provider into the room, whether it's another nurse, a doctor, whatever, and talk about it all together, and be like, okay, or have a conversation with your patient and then bring everyone, like, a kind of debriefing, right? And you'd hope that everyone in the room that, was a part of that. I'm sorry about the cat again, but
it's all right.
what he does. His name is Meow, and he always meows. But you'd hope that everyone in the room could kind of learn from that and be like, okay, next time something like this happens, hopefully that we'll be able to phrase it differently or do something differently so that woman doesn't experience that trauma. Unfortunately, we're, like you said in the beginning, we're just too busy and too, running around too much to actually be able to do that. I mean, I feel like even as nurses, like, regardless of the patients, when we have crazy things happen, I feel there should be debriefs all the time. I feel like after every single shift, there should be a debrief, really.
Agreed.
And I don't know what it's like in your facility, but where I work, there's very rarely that we have debriefs unless there's like a crazy event where like, and even then I don't even think we really do it unless somebody's like adamantly asking about it, right? And it's and I think they know that that's wrong. Like, obviously we should be doing it more often, but I feel like even with patients it should happen, I don't know.
There are so many like system limitations. As an individual, I usually just say something as simple as, hey, like, today was a big day, but also your personal experience was big, was scary. What, put in
and it
the
matters.
Was what?
It matters. Like,
yes. And I see that. I'm identifying that in your situation. It is something that you're going to want to and need to process. And that can look like writing it down, talking it out, talking to this, coming back to this provider, getting your records, like, depending on how well I know the patient and what the situation is, getting the story of your birth experience from the perspective of the providers. And that's me saying, read what I wrote. Like, that's not comfortable.
No.
But I know, because I work with birth trauma survivors, I work with assault survivors even before their birth and after a traumatic birth, and, like VBACs and people who are like, I don't think I can do this again, but I have to for whatever reason. Getting their records is a tool that can be helpful. So sometimes I plug that as just a thought in their mind, because I know they'll probably forget like 80% of what I say.
Yeah.
But
that's
they might.
Problem too.
Yeah.
Is that, we can talk about it right after something happens, because we're as labor and delivery nurses, we're there for a couple hours after their birth.
Right.
Maybe 3 if it's like a lot going on.
But maybe even not. Maybe the like importance, like that something happened and we don't even help them through the birth. We were with them through the admission or through the labor.
Yeah, exactly.
And so we don't, to follow up during labor, like, that's odd.
I know. And then I go back to, like, I've talked about this a lot. I don't know if we've ever talked about it, but I just think there's a huge gap in like postpartum, because like once they're postpartum, they go home, it's all about the baby. It's about breastfeeding, which is okay about the mother, but not really. I mean, it's about the baby, right? Is the baby gaining weight? Is the
not
baby
weighing the mother's breast?
The vaccinations. The baby needs to, and yes, you get the 6-week appointment, but even that, like, it's really nothing. Like, maybe if you have a great doctor, they'll go over like the mental health questionnaire, and they might debrief about your birth or ask you questions. But I think, for the most part, again, a systems thing, they're in a rush. They kind of, they have a quick look at you. And if you look normal and you look okay, then they kind of send you on your way. And like you said, it's a hard thing to bring up. They might have been involved in the trauma. And so I think it's a huge just lack of postpartum care, like.
And talk about it.
Yeah, because even if we just had like some kind of system where it'd be like, I feel like you had a good experience, but if there's anything that, you feel could have gone better, or you're having some thoughts or doubts or questions, call this person, you know what I mean? And there'd be some kind of like, I don't know, that's an ideal, if I were queen,
right.
Some ideal scenario where, and I think we talked about this in the last video. I had my first son in Iceland, where there is a very kind of good postpartum care package where, your midwife comes and sees you regularly after the birth. But still, I don't think for the mental health piece, I still think it's like really focused on the physical. There might be a couple questions here or there, but not enough to actually like probe into, you know, your experience, et cetera,
Right.
et cetera. And I think that's where that's where we can help women, is in that, you know, in that area.
Yeah. Nurses can totally do that.
Mm-hmm.
Bringing it up, acknowledging, and I've heard this from people that I know closely, and they were able to say this to me, which is acknowledging, and something that I enormously regret in a lot of ways, in a lot of cases, but acknowledging that something was there. And either, you know, it's so hard to say if it was a person, if it was an individual, because you are on a team, and it ruins a lot of things when you do that. But it also really empowers that person to be like, okay, no one, like, y'all just were watching something bad and not even acknowledging that it was bad. You acknowledge, like, that was intense, or that was scary, or that might have been whatever the word is. Acknowledging it is huge, even if it's not postpartum, even if it's in the minute, and being brave about that, because you're strengthening your relationship with that person. You're not putting thoughts into their mind, because if you felt something, the room felt something.
Yeah.
And I think it's okay to do that. It's important to do that. I think that'll decrease as nurses, our trauma and our like feelings of regret and loss. And like, should we have done something, like just like, if you were my sister, I would be like, are you okay with that?
Yeah.
I think it's okay to say that, because you're trying to advocate for them anyways. How do you know if you're advocating for them if you don't know how they feel about something? And then where to send people. So I don't have a lot of good places to, I mean, I do this stuff. I work with people one-on-one through trauma, but it's very personal, and it's slightly time consuming. It's not something that you can do in an outpatient 15-minute appointment at your OB. No. I work with people for a couple hours at a time, and you can go on Zoom and just do what we're doing, which is like talk and have video. And I don't recommend like everyone drink a beer, but I wouldn't if I were on the clock, but you know, it's casual. But there are like groups where you can work in a group, and there are other people who do online things. And then there are local like women's health therapists that some locations have.
Yeah, and that's another kind of hard thing, because, you know, therapists are expensive.
Yeah, it's
a lot of women have like,
you have to take your kids there. Yeah, it's not an easy. You know, if we were queen, we would have home health for mental health.
Yes.
And
obviously not a lot of people would need it, because the maternity care would be like top notch, and birth trauma would be like 1%.
What is that even?
Yeah, exactly.
It's for people who have specific things going on, and we sit and have coffee and we listen, and it's a lot of listening.
Yeah, for sure.
I think it's also okay to return to that person if something big happened. And this isn't made up. Like, talking about traumatic events right after the trauma happened is so much better, and it's shown to be better at preventing the severity of postpartum or of PTSD, and also PTSD-like symptoms.
I just had like an aha moment. I don't know if you do this routinely, but like I very often, if I'm like doing back-to-back shifts, even if it's not a traumatic experience, like just a, you know, regular old delivery, the next shift will go and visit that person. And just, if I have time, not always, but if I can, I'll go on the postpartum, you know, floor and be like, hey, like, how's everything going? Because now it's been, you know, 24 hours or 12 hours or whatever. And I was just wondering if, you know, you guys are doing well. And people usually appreciate that. And that's probably another kind of would be helpful way to be like, okay, now I've had 24 hours to think about what's happened. And they might have questions, right? And I'm just realizing I feel like I do that more for me, like to go see the baby and
closure. Yeah.
But it's
and
also
know
for them. Yeah, exactly. And I can just off the top of my head, I remember a few like kind of intense experiences, you know, someone coming in fully dilated and delivering really quickly, and everything happened so in an overwhelmed sense. So you coming back the next day, like, oh, you know, thank you. You remembered me, and you acknowledged that, you know, what happened was crazy.
Drive by.
Yeah, exactly.
So if your nurse did that after your birth, let us know down below. Just say, I don't, bomb nurse.
Yeah.
No, tell us. We want to know if that happened. If you're a nurse that does that, right? Next day nurse.
Yeah.
Because that's hard to do. I've gone to the other unit that the person is on, the mother is on, the family, and they're like, I haven't gotten my food tray. I need more underwear, and
I always have to help
also,
someone with breastfeeding.
and they always need help with breastfeeding, and I'm like, oh. I think that's why I really struggle with helping newborns breastfeed. And when I go, I know I'm gonna want to help them and just get frustrated.
Yeah.
That's probably why I have a heart. Like, I think it's difficult to go.
Yeah, to go. Yeah.
Because it's not a quick trip.
Yeah, and by the way, just a side note, again, I'm not a perfect nurse and I don't do this every single time. I wish I could. I wish I had, like, hey, you have an hour in the beginning of your shift where you don't have to do anything. Go visit all your patients from yesterday. I wish that was the case. I only really do it when I have time, when it's a slow day for whatever reason.
And don't have time. Mm-hmm.
Yeah, and you just remember that person. You're like, oh, I really need to see, how they're doing. And it's awesome if you can, but, by no means is a prerequisite or, something that everyone has available to them, because a lot of hospitals, you're so busy, it's like you never have that shift where you just are sitting down doing nothing.
I think that there's an enormous problem in the culture of healthcare and maternity care right now, is that people think they have nothing to learn.
Mm-hmm.
I already am respectful.
Yeah.
I don't need to learn how to be respectful because I'm a respectful person. Or like, I live in the South of the US. And so we're all ma'ams and sirs. And regularly I hear things like, oh, you need to put your gown back on. Like, we don't need to be naked around here. Ma'am, that's not respectful. That's minimizing. And that's not going by what she wants. And that's not being flexible. And like, grow up. Besides saying like, you have a lot to learn, no matter who you are, we all do, is so I said language. What was the other thing? Oh, talking about just offering any sort of language that you can around processing later. So like, hey, what's helpful to some people who experience something really scary in their birth is to keep talking about it, and maybe to a professional, or in the future, as you wrap your head around the events that happened, or writing it down is helpful. And then going to see people after their birth, whether you think it was traumatic or not, just going to see people and not talking at all.
Yes.
Like when you go to see your moms,
yeah.
Like, what's it like? Do you like
after? Yeah.
And say, hey.
I won't say very much. You're right. It'll more just be like, hey, remember me? I was at your birth yesterday, or something like that. And it's like,
always say your name.
In. Yeah. Just checking in.
Hey, just checking in.
Yeah.
I sit down. I try to sit down. There's never a seat. I try to like put my butt on the sink or something.
Yeah.
Put my hands in my pockets and just
want to kind of be eye level if you can.
Yeah. And just say, how are you doing?
Mm-hmm.
Or how are you?
Yeah.
And that's it.
Mm-hmm.
You don't have to say anymore. Just like, oh, wow.
And most often they have a lot to say,
mm-hmm.
and they'll tell you everything, right? And they'll kind of,
they're just starting to take in that baby, but they're not done giving what they just did.
Yeah. But sometimes I find that that's probably the first time that they're retelling their birth story. Even if you were there, they'll be like, hey, remember when this, and this happened, kind of, and they go back, when you're talking, like, for example, the epidural didn't work, or, and they're kind of like almost asking you to recount it with them and be like, why did that happen? And maybe, and that's why I think sometimes it can be very helpful, because you can give them explanations that they kind of, they might have been ruminating over, thinking, why did that happen? They didn't understand it in the moment, but now that they're not in pain and they're kind of maybe have slept an hour,
yeah,
they'll see things a little bit more clearly. And I mean, you were there at some point in time, and so you can really provide that insight for them. And I'm sure it's helpful.
This is such a good topic.
It is.
This is so important, and now I want to like go hold all my people, because
I know,
because it's so good as a nurse when you see now this doesn't happen for everyone, but when you walk into some rooms, their eyes just light up when they see you. Because even if you thought it was bad, even if you didn't get to see the baby come out, even if you thought like you were there for such a stressful time, they feel like they know you so well.
And they do. That's the thing that I always tell myself every time I walk into a room. Well, not every time, but I try to remind myself often, you know, this family will never forget you. Like you were part of one of the most important days of their lives, whether it's traumatic or not, or just extremely elated and happy, and you know everyone's like in blissful state. They will still remember you. They might not remember your name, but they will remember you. They'll remember what you look like, and they'll remember what your kind of aura or like the feeling they got from you, because it's just, that's how it goes. That's how memory works. Like if you read anything about memory, big days and big events, you know, they are imprinted on your brain forever. And it's not just, you know, in the next 10 years and then it's forgotten. It's like until the end of your days.
Until
so, like,
they die. They remember that day.
It's our job. It like puts such an importance and like weight on what we do.
It is.
It's kind of scary. Okay, I have to stop right here.
Go get your chicken.
If our chickens die, then I'll never be forgiven. Chickens are safe. Everybody's safe and happy.